Well, everyone, thank you so much for being here. We've still got a couple arriving, but I think we'll get started so we're not keeping you all here on a school night too late. So my name's Julia. I'm sure I've met many of you before, but not everyone as yet. So hopefully by the end of the evening, we'll be bosom buddies and lots of friends. So do come through, have a seat, ladies. That's okay. Someone will grab you a cup of tea. We've got skin herbal tea on the offering. I know. What else would we have at such an event? Oh, so just a bit of housekeeping before we get started, if I can. I'm sure everyone's got more than one mobile phone. If you could put it onto silent or flight mode, just so we don't get interrupted while our speakers are on their topics. And we all know where the exit is. It's right there. And we hope tonight to finish at about 7:30. But if everyone's enjoying it, we're happy to go on a little bit longer and stay around and have conversation. So if I can start by acknowledging the millennia of our ancestors collectively from all around the world and their contributions to healing. I'm sure many of us come from natural healers in our background, but also to include the Whadjuk healers of the Noongar Nation. And these are the traditional medicine people of the land on which we meet today. So, as I said, my name's Julia Smith. I'm a naturopathic medicine practitioner here at Remede. And I'm so excited to talk about skin tonight because I treat a lot of skin conditions, but I don't really think about the health of my own skin that much. So I'm going to learn tonight as much as you guys are, I'm sure. I'll walk away with lots of practices to be playing with at home. And we've got such an amazing collection of expertise here tonight. So I'll let the team introduce themselves one by one. So Lauren, sorry, you just took a sip, but I'll start with you, Lauren.
Hi everyone, I'm Lauren. I'm a naturopath here at Remede. And similar to Julia, I love working with patients on skin health.
Hi, Jane. My name's Adam. I'm a resident acupuncturist here. I do cosmetic acupuncture, among other things. And I'm treating skin disorders for the Chinese medicine approach.
Fantastic. And our special guest tonight.
I'm Fran. I am a facialist. I've got a background in skin, but now I specialize in sculptural pain.
And we'll all find out what sculptural and buccal massage is tonight. And sorry, Jane, I'm in your way.
Hi, I'm Jane. I'm a clinical and sports nutritionist, but my background's actually in the beauty industry. So I love the combination of skin and health and all the little tips and tricks that go along with that.
Right, we're going to learn so much this evening. So with a show of hands, and no pressure tonight to share, but it would be lovely if you're happy to. So just by show of hands, who's here tonight to think about healthy skin, healthy aging skin? Yep, quite a few of us. Yep, great. That's me as well. Who's here to learn about skin conditions? Is there anyone that wants to learn more about? We've got someone in the background there. Yep, great. So things like acne, psoriasis, eczema, we can talk a little bit about those skin conditions tonight as well. Urticaria, rosacea, these are common things that we treat in a holistic way. So we've got some slides, and this is really just to keep me on track because you know what I'm like. I can go on. We'd like to start with the naturopathic view of skin health. And Lauren, maybe if we can get you to speak to this area first with, I think holistically, we all understand that a lot of health originates in the gut. And I'm sure we all think about the gut in our treatments. What do you think naturopathically, where does gut health fit in for you?
Where do I begin? So in terms of gut health, I really like to consider the gut as the mothership of everything. And particularly when it comes to the skin, it's really, really important. And what I'm really thinking about with skin and gut health is I'm thinking about the gut skin axis. Has anyone heard of that before? But yeah, maybe get right. So with that gut skin axis, it is a bi-directional relationship. So the gut affects the skin affects the gut. Now, mostly I'm going to talk to, how the gut affects the skin. And that is via inflammatory pathways and also via like immune mediators and immune system as well. So that's mostly kind of what I'm thinking when it comes to gut health. Then beyond that, we need to be thinking about the microbes. So gut microbiome health, it's a very hot topic and it has such an influential role in our skin. So I would say 9 times out of 10, if I'm working with a patient on skin health, we're looking into the gut and I'm assessing, at a microbiome level what is going on with those microbes. Now, when we say microbes, I could talk this for the whole time probably, so I'll keep it short. Well, when I say microbes, they're talking about, the good, the bad, and the ugly in the gut, and particularly in terms of microbial overgrowth. This is where we may see some potential skin conditions, whether that's eczema, acne, psoriasis, rosacea even. So we want to assess those microbes. Now, beyond that, I'm also thinking about inflammation in the gut, and that could be, coming from a diet or stress. I'm thinking about the gut lining, so considering like leaky gut or that what we call our hyperpermeability of the gut lining. And that's really common conditions like eczema. I'm also, of course, thinking about the good microbes and short-chain fatty acids because they, manage that inflammation. Is our immune system working? So if your immune system is compromised, it's actually usually coming from the gut because most of our immune cells are in the gut, and most of them are 80% cells. So again, we need to be thinking about that immune system. And lastly, nutrients as well. So, are we absorbing our nutrients in the gut effectively? And when I say nutrients, I'm thinking about, like your essential fatty acids, which are really, really important for skin, protein, nutrients like your iron, your zinc, your vitamin D, are also very, very important.
What sense?
They can't wait for that.
Yeah. So would you say there's so other than the gut, do you think there are other primary sort of causes of the various skin conditions? So would acne be different to eczema? Is eczema different to psoriasis? Or does it all really come down to the gut?
So every skin condition has a bit of a different, background. And absolutely, there can be a genetic component there. So particularly in terms of conditions, in my experience, like psoriasis and eczema, often there is a genetic component and there might be family or, brother or sister that has that condition as well. That's really, really common. So genetics. The gut has obviously a big role to play as well. But beyond that, there's often other components of health, like you can see on some diagram here. So we're also thinking about, allergies and allergic response, particularly when it comes to something like eczema. That's usually quite a big component of an eczema or dermatitis condition. And a big one as well that I can't not talk about is hormones. It can influence so many different things. And absolutely when it comes to skin health, our hormones can really, really affect, even just our having healthy skin, but definitely when it comes to things like rosacea or dermatitis.
I already want to ask you about diet, but I know that Jane's going to tell me off because she wants to definitely talk about food, I'm sure. Maybe let's come to that straight away. Is that okay if we go there straight up?
Sure.
Yeah. No, I won't. I won't do my ADHD thing. I'll stay to the focus. So, with that in mind, then, are there herbs that you love? Are there herbs that you use for everything? So, regardless of the skin, is there a certain herb, or does it matter which condition you're treating?
It definitely needs to be individualized. So, with herbal medicine or any type of supplement, we don't just want to be throwing everything at a skin concern. We want to be really particular with what we're using, why we're using it, and what form as well. So with herbal medicine, there's so many different herbs, and we've actually got a few of them in tea, which is quite nice. There's so many different herbs that I love to use, but it really depends on the condition. For example, we don't want to use a herbal medicine that could cause more heat in the body for some people, which we'll also talk about the heat component, because that could actually worsen the skin concern. So it's really important that I'm really specific And typical herbs that I like to use, just as examples, is, they're really nice anti-inflammatory herbs that can work quite well. But I always want to know, okay, well, yes, there is inflammation, but where is that inflammation coming from? What is the drive carrying that comes from poor detoxification? Is it coming from the gut? Is it coming from the diet? Is it coming from toxins? So, inflammatory or anti-inflammatory herbs are great. Beyond that, I love to use lymphatics, which are going to stimulate the lymphatic system, which is going to stimulate the immunity. And we're going to talk more about lymphatics today. Depuratives are also really, really effective in the right situation. And that depuratives actually can cleanse the blood. And it's the form of detoxification, and that can actually get to the skin. And then, of course, if there is a collagen component, I'm definitely using herbs as well to manage those.
That's, I think, the beauty of herbs as well, is that some of them will have that digestive effect as well as immune effect, as well as depurative effect, because they're plants, so they have different phytochemicals. Wonderful. We'll come back to you if we can, but let's move on to, so I know you've got a case that you wanted to share with us, but do you want to run through that quickly, and then we'll move over to the acupuncture side of things? That's going to be fascinating too.
Yeah, so this was one of my lovely clients who had chronic acne, and it's been going on for a while post-pill. And what we did with this particular client is we did do standard pathology testing just to assess her nutrient status. And why that's so important is, in terms of nutrients, we need to make sure we've got nutrients that can support the skin heal. If we've got a deficiency just with zinc or with iron, that's actually going to then the skin's ability to heal. So that's really important. But what we focus on here, and that can doctor there as well, is the microbiome mapping was a game changer for a client. She wasn't eating amazing, so we really ramped up her fibre. And just supported those detoxification pathways. And another component of the case was that she wasn't having daily bowel maintenance. So she wasn't actually clearing the toxins and the excess hormones that we found in her bloods. And that meant her gut was really overloaded. So we had some fantastic results. We just were cleaning up her diet, addressing the microbiome and shifting the way. It's climax.
Because if your gut doesn't have anywhere else to dump the toxins, the skin is an obvious place for it to go, isn't it? Yeah. Awesome. So thank you so much. Let's move on, if we can, to our traditional Chinese medicine space. We've got some fun things to talk about. And we already started before you came out discussing acupuncture for the skin, and you do actual. I think of it as an alternative to Botox. It's a different type of needle for the skin.
It's a lot more gentle for one. So the Botox, obviously, usually got hypodermic needle, whereas the acupuncture needles come in a variety of sizes. But in particular, the cosmetic acupuncture needles are only a little bit thicker than a strand of your hair, or for those, maybe beard hair, for example. But we use the skin for lots of different things. It's not just it's your first line of defense. It's not just our meat suit. It's also the way that we expel toxins. So circling back to what Lauren said before as well, when your patient wasn't digesting or getting rid of the toxin properly, that's where our skin then kicks in as well, because that helps to purge toxins, and then and it can localize in different areas depending on what the pathogenesis is. So we use the skin a lot to help just eradicate and regulate our immune system. So, and sometimes it's the herbal remedies to encourage you to sweat, or just to encourage you to get to the toilet. And similarly here, so this is the different pathways in the face. So we've got, they call them meridians or pathways. So this is the needle. This is the energetic pathways that we do needle in the face when we do cosmetic acupuncture. And you'll see that all of the ones in the face, they're related to more so our digestion. I think you can all agree that digestion is key. It's what we're putting in is going to manifest somewhere in our body. And if something's a little bit lazy or there's a blockage there, it physically manifests on the face and we can see it map that. So these lines are pretty straightforward. While they're the lines here as well, they're not needles in every line. So, for example, we can see the stomach, which starts just under the eye here and it finishes in the foot. If we're using that pathway to stimulate the blood flow and the collagen production. So the cosmetic acupuncture is really good for boosting collagen, the elastin in the skin, and also for the lymphatic drainage. So while this is the pathways that we use, from there, it's about maybe 14 needles that would actually go into those pathways. It's not going in there in every location. So then also diagnostically, when we're looking at the presentation, there's another slide to come up. This is the energetic pathways in the body. And this here is like more of the manifestations of what's going in the internal organs and how it presents on the face. And that can be from acne to rosacea or all sorts of different skin pathogenesis from eczema. So when we're presenting the skin like this, we're looking at it and then go, the reproductive one, it's an obvious one. So we're looking to balance out the hormones. We're looking to use the channels in the body, the energetic pathways, more distally as well. It's like we want to look to stimulate and turn the channel on and to get it to flush and to move. A lot of the times when it's heat excess, we try to use maybe more so points in the feet to help eliminate that the heat in our bodies.
So am I right in saying, sorry if I can just interrupt, that when you're doing the cosmetic acupuncture, so you're not just acupuncturing into wrinkles, let's say, you're using the mat to guide you, not just to produce collagen where there seems to be a need?
Yeah. Well, we do fill the spaces with the needles. Absolutely, there is that direct approach there to fill in the fine lines, and they kind of butt up together. That's promoted that collagen there. But a full diagnosis is done first to ascertain like what is the cause of, or where is the places that of interest, or where the wrinkles are not wrinkles, or the issue is most localized. And then we're using to the rest of the body to help regulate that without necessarily just filling a space with the needles, because it can be a little bit spicy at times.
Spicy.
So there's just more of a sensitivity to the face because it is so heavily vascular. So there's lots of blood there. Mm-hmm. And there's also lots of like our lymphs are in our face as well. There's lots of little superficial nerve endings as well. You have to be certainly mindful and delicate with. But yeah, so looking at this here, for example, the glabella lines here, these are more of a complicated one to help get rid of. So I would needle directly into these, but this is also the manifestations where the liver is located. So then I'll be looking at what's going on with the liver. Are you struggling to process, or is it a blood filtration element to it? And using the points of the liver channel, which are in the leg, to help regulate and stimulate this from down below. So it's the treatment cosmetically is not all about the face. It's about what the underlying condition is to start with.
And then outside of beauty, are there other skin conditions that respond really well to acupuncture?
Yeah, well, acupuncture is a really great direct approach. We always pair it with a herbal medicine. So it's about whether we try to clear an excess, if it's excess heat or there's inflammation, there's herbal remedies that we use to help encourage the body to excrete them. While the acupuncture itself is a beautiful direct approach, and it is great at stimulating, getting things moving. And it's not just the needles themselves. There's lots of techniques, as I'm sure you'll see in the other slide. There is the mapping for the gua sha tool. And originally the gua sha tool is not actually used cosmetically. It roughly translates as scraping until it's red, because you want to stimulate, and that's how we're getting the heat out of the body. It was later adapted for the face for beauty, but originally
influencers. Yeah.
And then attach an appropriate price tag with the tool as well. Because the tool's very, very simple and very broad. But
who here uses a gua sha? Yeah, couple of you, correct.
I'd highly recommend it. It's a very quick way to get a really good result. But the whole technique is gua is to scrape, and sha is the red color that comes out. So when we're following these pathways here, it's pretty straightforward, and you adjust and move the tool for your own comfort. But you're causing like a light trauma to the skin. You actually want it to get a little bit red and inflamed. That's how we're getting the blood to come to the area there. And this is probably the most popular shaped gua sha tool, but it's a new and a recent adaptation because it was originally called gua sha. It's also called scraping, spooning, or foining because we even just use a soup spoon. It's about just getting it on the right angle. And it's fantastic for removing that pathogenic heat from the body. So if someone is presenting with lots of heat here and it's manifesting in different locations on the face, I'd actually use the bladder channel, which runs down the back, and try and remove some of that pathogenic heat. And that's really capitalizing then on the skin's efficiency to help flush things from the body.
Interesting. The gua sha, do you put something under it?
Yes. So a carrier's oil as well. Thank you. Because if you were to put this straight on your face, it's going to be too rough and it cause you pain. And you'll definitely get that sha come up. So this will be, it take a while for it to heal. So my recommendation actually is just argan oil and frankincense. They're both fantastic for the skin. They're super old. There's a reason why they're still in circulation now. And I guess there's lots of great gimmicky oils out there. Like every person that sells a gua sha tool sells it with their own suggestion of an oil as well. But in my experience, I just think keep it super simple. The argan oil is commonly used for the hair, but its viscosity is very light. So it doesn't block the pores, which is fantastic for people that do have acne issues. It won't block pores and it's quickly absorbed into us.
So you could still do that if you've got blemishes like acne and it's great.
It's one of the only oils that won't block pores. So it's my recommendation.
And quickly before we move to lymphatics, because you've sort of introduced us to the lymphatic world with the gua sha, where does cupping come into this? Because we've all seen athletes do cupping and you see that redness and that sort of bulbous mark on the skin. Obviously, that's using the skin, I imagine, from a toxic release perspective. Is that what cupping's about?
So I guess it's popular purely for its musculoskeletal element. You'll see lots of gymnasts, Olympians, that's where it probably got popular. And you see the cut marks on these prime athletes. But originally, yes, we do use it musculoskeletally, but it's also used as a treatment, but diagnostically. When you take the cut off someone, you can get an understanding of what's going on deeper in the muscle. Like if you're using it on the lung, sometimes you can actually pull liquid purely out of the skin, and we call that a turbid fluid. So it is quite almost toxic, the stuff that comes out, or it can cause a blistering there on the lung as well. I mean, the first time I saw it, I'd never heard of that happening before, but it was the person I was using on, they had lots of phlegm and fluid in their lung. But the use of that is more than musculoskeletal. It is to help regulate the toxins from the body, just pulling things to the surface and capitalizing on how efficient the skin is on getting rid of stuff. That's how we get things out of our body if we're not passing them out. Our skin is help pushing them out. We're opening our pores.
Yeah, fantastic. Thank you for that. If we can, we're going to move on to lymphatics. And Fran, thank you so much for being here as our special guest tonight, Fran. It's Jane next. Sorry, my fault. I've done slides tonight. That's what's confused me because normally I just go wherever I feel. We're going to Jane next and talking about nutrition. So we've got a little bit of a slide up there. Sorry, guys, it's a bit hard to see tonight because we couldn't get it. If we put it further back, you'd all be out of a seat. So we started talking a little bit about the gut health, or a lot about gut health and the herbs that we use. Where do the nutrients? What are the specific nutrients that you love? And is there a diet? Is there a one diet fits all for skin health?
I suppose yes, in a sense. But I like to think of food as medicine, obviously, because it is. And that's how I've wound up doing what I do now. I wasn't in this space. But, most people go into areas of professionalism to cure themselves, I don't know. Anyway, so as a baby, I had horrendous eczema until I was about 22. And then from the age of about 13, acne, and then severe cystic acne until
well, it still sometimes comes, even though I'm postmenopausal now, but isn't that wonderful, temple and menopause at the same? We should talk about them. Why? Some genetics that obviously make me predisposed to that. But it was interesting. My mum and dad were very vocal, let's say, and would, didn't want to have silent treatment to each other. So I thought it'd be great that they should argue in front of the kids, whatever. And mum said that when I was a baby, if they'd had an argument, I'd wake up with eczema the next morning. And that was as a baby that didn't even understand language. And yet, so stress and emotions are a really big part of how our skin behaves. But obviously I have been on my own skin journey, as they call it. And I believe that food and topical and internal cured my acne and eczema. So I've just been driven to help other people with that as well. But, going back to this, I love to, teach people about, it's not, yes, it's mainly gut and it's definitely food, but there's other things that affect our skin. So obviously, in winter, we become actually drier because there's less humidity and moisture in the air. When we're using the incorrect products, and I could talk about, that's just another whole week of training, is just about skin products. I worked in the beauty industry, 20-something years or whatever, so that's a big thing for me. Product overuse, but sun exposure. And I don't want to say the wrong things, I don't want to preach the wrong thing, but 4 out of 5 wrinkles, so 4 out of 5 wrinkles caused by the sun. And I remember training with a French esthetician, clinical, face treatment lady who came over from Paris to train where I worked. And she would say, oh, you all look so much older. And she'd say it in her French accent, and she was quite rude. But we do it in Australia, I look 10 years older. And I used to have this saying, you choose your, well, that's not the saying, I shouldn't say that. As if I said your ass, that's another story I've got for you. But the story is, people are like, oh, no, not really. And no, but will you check the skin on your bottom, right? And compare it to your face or your arms. And you can, you can see what the sun does. But now I can't really say that because all girls are wearing, like that's not true. It's all exposed. Yeah. The dark future. I'm going to get around that. But 4 or 5 was caused by sun. So I've never really been sunburned because my mum was ahead of her game. She was a nurse. She makes wear seatbelts when they weren't even legal, and, sunscreen. So I've always worn sunscreen. I thought that was very important. And then obviously being in the beauty industry, but then there's that sort of like, we're so covered now, and, we don't, skin cancer, we've become obsessed that people are now vitamin D deficient, and the world would not operate if there was no sunshine. The plants would not grow, the earth would not, so we have to find this happy medium of having sunshine and how important it is for our mood and our energy and our skin, but also protecting ourselves. So in the environment I am now, I will just cover myself. So I always wear a hat to the beach, sunglasses, long sleeve, but then on my face, I will wear a physical sunscreen. So different to a chemical sunscreen. So a physical sunscreen is usually zinc or titanium dioxide, and that actually has a physical barrier to reflect the sun rather than absorbing the chemicals in the body. So I like to do it as naturally as I can. So I know that wasn't even a question. I was asking about diet, but I like where you went. I love where you went. That's good. Pollution is a big one. Anyone's lived in China, it just after a day shopping. And then obviously that's the external stuff that's going on. I promise you that is just like robbing all oxygen flow. And then doing a whole bunch of other stuff. So like that is really bad. And then internal hormones are a big one. It's genetic. It's the age and stage. Yeah, the diagenetics, medications. Oh, there we go. Yeah, and diet. So yeah, I'll just they came there. You got there. I love it. Anyway, probably time to go home now. But what I like to think is that food is medicine. So I think about this: everything you put in your mouth, that you chew, that you break down, that then goes into the precious gut, which then breaks down even further and gets absorbed. It gets broken down, and then it's fuel to make our body. Like that is what we're made from. We are made from food. So every little skin cell, hair, organ, heart, blood is all made from our food. I mean, correct me if I'm wrong. That's why I think food is medicine. So food is just hugely important, and I had to figure out for my skin what it was. And it's not one size fits all, no, but quite often I find people, may have an intolerance to dairy until we can heal and seal their gut, or it could be something else they're eating or a food allergy. But I just like to go, you know what, can we eat the rainbow? And
So tell me then, what are your non-negotiables? Are there some foods that are just, it's an absolute no for anyone with skin issues? What does it come down to, nuts and bolts?
let's stop opening so many packets. That's to me what it is. Like, if we could say whole foods, that's a bit elusive, but the less ingredients that are on a packet, or the less crackling opening of packets, the better. So I go, whole foods is non-negotiable. Eat foods as close to how they are. I mean, we're all time poor, whatever, you can still get great fresh foods. They're pre-made or from the supermarket, lots of handy things. But my non-negotiables for good food is healthy fats is really important to lubricate the skin. And, you can tell when someone's got a good diet, their skin looks good, right? And you can tell when someone lives on not food, but junk food, because that's not food, that's just junk. We can tell, and that's what you will come out in your skin. But it's fibre, and we've talked about, when I talk about bowel motions, what did you said bowel movement, and you said something similar. I say poo, but that's fine. But we have to, it's got to come out, otherwise it comes out in the skin, right? And so it's fibre. And fibre also is really tricky and clever because it feeds all those gut microbes, right, which then go on to do wonderful things inside. So fibre is very important. I talk about, we had that little chart here that we give to everyone going, 40 clients a week. And but it's okay because it includes nuts, seeds, grains, brown rice, white rice, herbs, spices, all those different things. And I think about it as, the rainbow. I think the next slide. Yes, there you go. Yes, look at that. Food. You are what you eat. It's the rainbow, and every little colourful bit of food that we pop onto our porridge, or, the handful of salad in the wrap, or the lentils we throw in, all those different colours are like little magic pills, and they are all being broken down to make our skin. So that's fibre is super important. Drinking filtered water. I know it's a big step for a lot of people, don't even drink water. So getting them to drink some water is like good, better, best. Let's get drinking water first. Best is probably hydrogen purified reverse osmosis, add the minerals back in. Been blessed by an angel. Been blessed, the tears of the yak, all that sort of thing. That is probably the best, but if we can get people hydrating and flushing out is really important for keeping the skin. And also hydration comes in fruit and vegetables, so it's a double whammy, getting them lead vegetables, they're being hydrated. So true. Or a herbal tea. Or a herbal tea, as everyone's enjoying. Protein and collagen, super important for the skin. And I set up a little display at the back, and you can look at it later, just on some things that we have spoken about already and are going to talk about: the sunscreens, the gua sha, some lymphatic stuff we're going to talk about, some beautiful skin products, but also some collagen powder. So collagen powder is fantastic for our skin. I'd like to throw it in the smoothie, yogurt or whatever, but protein's really important as well. So eggs, meat, fish, whatever. And lots of little minerals, and that they come in our nuts, seeds, and grains. So really important. We talked about zinc and iron, how important they are for the skin, and all the antioxidants like vitamin C, because we know that vitamin C is a precursor to help us make collagen. So it's fantastic to use vitamin C topically on the skin, but also to eat the vitamin C rich foods. And there we go. Love it. Love it. It's great. I think so.
Yeah. Leading from the piece about antioxidants, I saw a great piece of research on women that they fed them a diet for a 4-week period that was really rich in polyphenols. So they were eating things like, the heritage tomatoes and purple foods, the really brightly coloured foods. And after 4 weeks, they took photographs of their skin before and after. And then they actually showed these photographs. So you could visibly see that their skin had changed. They looked more tanned. It wasn't they'd been out in the skin. They literally looked like they were glowing from inside. And when they then showed these photographs to a collection of other people, so that it was a 2-tiered study, all of the people reviewing them said that the healthier people were those with the darker skin. So we do correlate good health with the tone of our skin, but it's not because of the skin looking good, it's because it reflects good health. It reflects what's going on a nutritional level. And I thought that was fascinating. So food is awesome. I had a specific question that I thought came from what you were just saying about collagen. I don't know if anyone else in the room is wondering what's the best collagen. There's a lot of collagens around these days. Is it marine collagen? Is it beef collagen? Does it have to be a certain amount of collagen? Anyone can come back on this one. I know you've all got thoughts.
One that I've heard there. I like this one because there are 4 types of collagen, type 1, 2, 3, and 4. I can't remember which one's which. But this one is the type that is good for skin, hair, and nails. And this is the marine collagen. You can't taste it. And people put in their coffee and all sorts of things. And then the other one is for bones and tendons that you can also be prescribed. And we've got a super one here that we prescribe to people that's got a combination of everything in it and get super awesome as well. But I love this one. And, I've had people that their skin has become thicker and more radiant and their nails are bright for the first time ever when they've introduced collagen into their diet.
Nice. Yeah, nice. I like the one that has the other types as well for gut health, particularly if we need to do a bit of gut health for joints. Excellent. Okay, well, moving on. So we've got some time for questions at the end. Let's jump to Fran. And Fran, I wanted to thank you for coming along again to talk about lymphatic. So we learned a bit about the gua sha. Can you share with us what the lymphatic system is? I think there's probably a bit of general knowledge in the room, but if we can just dive into that for a moment and what the benefits are in terms of working with the lymph for skin.
So the lymphatic system is basically like the cleansing network of the body. So it helps to detox everything out that we don't want. So whether that's like waste, cell debris, anything that we just toxins basically. Why not? And when our lymph system is sluggish, it can really show up in our skin. So it can show up as like a lot of inflammation in the body. You can get a lot of like dullness in the skin and acne, congestion. They're all kind of signs of a sluggish lymph system. And when that sluggish lymph system is we had it for a very long time and we're not doing anything with it, over time that can really and make the aging process a lot quicker or make the visible signs of aging a lot quicker due to kind of, again, chronic inflammation that shows up in the skin alongside water retention as well. So helping the lymphatic system sort of like flush and work in a very healthy way is going to help everything detox out of the body. It's going to give space for the nutrients in the cell, like the oxygen nutrients to get to the cell so they can work a lot more optimally and sort of decongest and flush, basically.
Yeah, great.
And we have like major lymph nodes through our body. And so I'm showing on those where they are. So our major ones would actually be like underneath our collarbones. So these are main lymph nodes that drain the whole entire body. And which is surprising things with our and our lymphatic system is not hugged by anything else, on our own like muscular system. So we have to move to make it work. So when we sleep at night time, our lymph system kind of goes a little bit dormant. And that's why when you wake up in the morning, some people might wake up and they might just be like a bit puffy. To get up, you kind of have your morning, get ready, and that kind of puffiness kind of disappears. But ways to kind of help stimulate that along to reduce that pumpiness a little quicker would actually do a little bit of lymphatic stimulation every morning. And so I like to think of,
can you stand up and show us? Come on.
I like to think of this area as like the like a dam. So we have this dam, we have the river, then we have a lake. So everything from here up has to drain through our lymphatic system that's here. So if this is not working and this is not like switched on and opened, everything up here is going to get very stagnant. And so that also shows up in a lot of redness, to a whole lot of like inflammation and redness. So you start working through the lymphatic system, it's like incredible how much that drains. And so
Whoa.
Sorry, step to that side. You'll be out of the range. So we don't want to blind you. You'll never come back.
So which are underneath our collarbones. So if you wanted to give a little tap in the morning, that really, really helps. People do it now as well.
So is it just above the collarbone?
So I would kind of hollow out your collarbones. Just tap in there.
Gotcha.
They kind of like sit underneath. And a nice one also to do in the morning is just pitching the back of the neck and then rolling that forward. The reason why I like to do that is because we get a lot of that stagnation of fluid. Like I said, then this is not like flushing out. Everything becomes a little bit dormant. So we kind of just give a little bit of a squeeze and roll that forward. It's going to help bring any kind of excess fluid into that area that it
feels good too.
Feels really good. Once you start doing it, you realize how effective it is. And you can then come down, coming into the underneath your armpit. So I'm not going to touch mine, but a bit nervous. You can just give them a little bit of like a tap. So we have our lymph nodes underneath our armpits. And then I always like to kind of just like sweep underneath thighs, turn up breast area, and do a little bit of like the stomach circulation, pump everything.
So you don't seem to be doing very deep pressure. It's quite light from what I can say.
It's quite light in the skin, but there are certain nodes that are a little bit deeper. So that you can get a little bit of a squeeze on the armpits and you can go a little bit deeper. And coming down, you have ones down your groin. So you can just give those a tap. And then you can also tap the back of your legs as well. And then if you're laying down, which I like to do it in the morning, you can always put your feet up in the air and give their feet a little bit of a squeeze and with a rub as well. Once you do that, if you also have more time, you can also do some jumping is really good to get the lymphatic system flowing. And honestly, just doing that in the morning will change life.
I love that. You heard it here first. Fantastic. Jumping has been shown to be really good for bone density as well, hasn't it? So hitting two things in one. Fantastic. So what's the difference between, so you called it sculptural and buccal massage. How is that different so I'm assuming that's facial. How is it different to a regular facial?
So it is facial massage. So I guess when you're looking at normal facials, they're only kind of working on that surface layer of the steel. Whereas with the sculptural buccal massage, we're working deeper into the skin without being invasive. So but the sculptor techniques I use kind of like a face workout. So we are kind of activating and lifting each muscle to try and re-educate it. So we are stimulating the muscles that may sit dormant in the skin. And then when we work inside the buccal, it sounds a bit scary, but it's very gentle. And we're kind of working internally and externally at the same time. So you can really feel into areas that are tense. So we could feel the muscles and we could feel any stomach fascia and the adhesions. So we can really kind of like working and then soften those. And very different from normal facials. So it's you're more working on the muscles and the fascia rather than just cells.
And how often would someone do a treatment like that to get some good results?
It's very dependent. I have clients that come weekly, fortnightly, monthly, every 6 days. So it depends on what you want to work on. If we're talking about sort of facial aging and wanting to sort of like lift and sculpt the face, then just being regular with it, it's going to be amazing. If you want to work on something that is, I know a little about TMJ irons, really strong masters and do all the coaching, and we help to release this muscle. And it's very different to a chiro or a physio. Don't know if anyone's ever had that done. It can be quite painful. This is a very different approach. This is like yin yoga for the face rather than actually back massage. So I'm looking to like go in, release, relax, lengthen, create space. That muscle can like switch off and know that it's like safe. And what was question?
No, you answered beautifully. One, just for someone who might not know, the TMJ, what
that is when you get a lot of inflammation up through your web. Yeah, and lots to do with that clenching of the muscle. Yeah, so people flying through the night or they clench through stress. It's very hard to take off. I mean, muscles have a lot of muscle memory. Our jaw is actually very linked into our hips as well, and our hips hold a lot of like emotional trauma. So there's a lot of
soft.
Plus, has all of that, and you'll find that if someone's got a tight jaw, they use them at tight ends. So I always recommend my clients to do hip opening exercises, actually help release the jaw as well. Interesting. Yeah, they're all very connected and very fascinating. Very fascinating.
I just want to thank you for being here. It's been a great night. I think we've all taken something away. Can I please get a nice round of applause for our panel?